Hey everyone, my name is Renal Deng from Vanderbilt University. Today, I would like to introduce our PrPSeg model, which is universal proposition learning for panoramic renal pathology segmentation. To briefly highlight what we have in this paper, we are going to translate clinical anatomy into a hierarchical anatomical relationship in AI model training to achieve better segmentation performance for kidney pathology. Pathology morphology is significant for disease diagnosis in renal pathology. For example, several diseases can be identified through human visual examination of pathological tissue samples. However, human visual examinations are not always reliable, which may include variability such as image grading on different scales or image annotation on diseased samples, increasing the difficulty of the examination and reducing the accuracy of the diagnosis. Therefore, the benefit of the latest AI models can help experts achieve accurate image quantification through auto-quantification and complex analysis. In renal pathology, it usually requires panoramic image analysis from the region level to the cells level, which includes multiple objects across different scales. The common paradigm for training AI models to achieve segmentation for these objects involves providing the mask separately in a supervised learning fashion. However, no spatial relationships can be learned during the model training. Why is spatial knowledge important? Because if a pathologist wants to target a specific cell, she will use kidney anatomy to guide a visual search in a hierarchical way, which can improve speed and increase accuracy. For example, if she wants to find a podocyte, she will first look at the cortex, then find all of the glomeruli in each glomerular tuft. She will finally look at all of the podocytes. Therefore, for panoramic pathological segmentation, if we can incorporate this clinical guidance from taxonomy relationship into model training, the model performance can be improved by involving more clinical knowledge. According to this motivation, we introduce our universal proposition learning, which translates kidney anatomy into an anatomical relationship matrix that is plug-and-play and adaptable, modeling the spatial relationship among different objects. This matrix mainly contains two categories of relationships. The first is subset and superset relationship, where object B is within A. The second relationship is mutually exclusive, where two objects have no inclusion relationship in any case. With the guidance of the universal proposition matrix that we modeled, the corresponding anatomy loss designed from dice loss is implemented to supervise the anatomical relationships between two different objects during model training. Specifically, if class I is a superset of class J, prediction J should not exceed the region of ground truth I. If class I is a subset of class J, prediction J should cover ground truth I as much as possible. And if class I is a mutually exclusive of class J, the overlap between prediction J and ground truth I should be minimized. For panoramic image segmentation, the size of the data will extend over a long period of data collection, which is inefficient if the model architecture needs to be changed when new classes are included. Therefore, we expect the proposed panoramic segmentation model to be fixed in an incremental and continual learning fashion for future model training with new data. For this purpose, we propose our token-based dynamic design on the backbone that uses dimensionally stable tokens to identify the current task for pathological segmentation. This model architecture remains consistent even when new classes are introduced. We evaluate our methods with a dataset that includes 8 different objects across the region level, functional unit level, and the cells level in renal pathology. More details of the data collection can be found in the full text paper. Both quantitative results and qualitative results show that the proposed methods achieve better segmentation performance. We also evaluate the scenario when new classes are introduced. The proposed methods achieve the better performance in all new classes, while the universal proposition matrix is easily adapted and the model backbone is kept the same. To sum up our paper, the contribution of this paper is in threefold: the design of a comprehensive universal proposition matrix for renal pathology, the development of a token-based dynamic head in a single network architecture, and the formulation of an anatomy loss function for a better comprehensive pathological analysis for kidney pathology. Thank you so much for listening. Please feel free to reach out during the conference or via email for information on our latest study.